The goal of this video is to teach you to read an electrocardiogram, or for short, ECG or EKG. First, what is an ECG? It is a test that records the electrical activity of the heart. The ECG is used to test for irregularities of heart function and detect changes in the electrical activity over time. The way the test is conducted is by placing skin electrodes on different parts of the chest and back, which views multiple angles of the heart. There are 4 steps to analyzing an ECG. Step number 1 is to analyze the P waves. Are there P waves? Is there a P wave for each QRS complex? In a normal sinus rhythm, there should be a 1-to-1 ratio. Step number 2 is to analyze the QRS complex. Is it narrow or is it wide? Narrow would be a QRS complex less than 0.12 seconds, whereas wide would be a QRS complex more than 0.12 seconds. Normal duration of the QRS complex should be between 0.06 and 0.1 seconds. Step number 3 is to analyze the rhythm. Is the rhythm normal or is it abnormal? Step number 4 is to analyze the PR interval. Is the interval within normal parameters? The normal duration of this interval is 0.12 to 0.20 seconds. Is this interval regular? Another important aspect of reading an ECG is the ability to estimate heart rate. One method is to count the number of QRS complexes per 6-second strip and multiply by 10. 5 large squares on ECG paper is equal to 1 second. This will give you the approximate heart rate per minute. Here is an example of a normal sinus rhythm. All P waves are upright and there is 1 P wave per each QRS complex. Each section of the rhythm has a normal shape and QRS complexes are identical. The PR interval is of regular duration. The R to R interval is regular. This is observable because the distance between each apex of the QRS complexes are approximately the same distance apart. The heart rate in this strip is estimated to be normal, which is between 60 to 100 beats per minute. We are going to examine each component of the ECG. This arrow shows the P wave, which signifies depolarization of the atria or activation of the atria. The PR interval represents the time it takes for electrical impulse to travel from the SA node to the AB node. This section, the QRS complex, represents depolarization of the ventricles. This arrow is the T wave, which represents the repolarization of the ventricles or the recovery wave. We are now going to play a game called Name That Rhythm. What rhythm is shown here? This rhythm could present in a patient as seen in the following footage. This rhythm is sinus tachycardia. The ECG of sinus tachycardia presents the same as a normal sinus rhythm with one difference. The heart rate is estimated to be greater than 100 beats per minute. Sinus tachycardia may be caused by drugs, medication, anxiety, fear, infection, fever, chronic heart failure, anemia, myocardial infarction, or as seen in the video, exercise. This causes an increased workload on the heart. The rapid heartbeat doesn't allow enough time for the heart to fill before it contracts, so blood flow to the rest of the body is compromised. What rhythm is shown here? This rhythm could present in a patient as seen in the following footage. This rhythm is sinus bradycardia. The ECG of sinus bradycardia presents the same as a normal sinus rhythm with one difference. The heart rate is estimated to be less than 60 beats per minute. Sinus bradycardia may be caused by head injury or medications, may be present in a healthy, well-conditioned person, or as seen in the video, is common in early stages of myocardial infarction and associated with angina. This causes decreased cardiac output, resulting in symptoms such as lightheadedness, dizziness, hypotension, and vertigo.